HealthWorks, the knee, it's the biggest joint in your body. It's where the thigh bone meets the shin bone. It's kind of complicated in there. That's why using augmented reality to replace that joint is giving surgeons and patients a big advantage.
Did you know when I started out, I cut hair with my daddy?
She's been cutting hair for decades, but now 64-year-old Sandy Barber is doing it with a brand new knee. Arthritis combined with countless haircuts caused her years of knee pain.
You limp and you don't even realize that it's hurting. And I'm a barber, so I stand all day.
We were the first to do it in the country, and Sandy was our first patient.
Orthopedic surgeon Safa Kassab used brand new augmented reality technology to give Sandy her new knee. First, understand knee replacement involves basically shaving off the damage from the thigh and shin bones, then capping it with metal and plastic parts. But spacing and alignment is key.
In order to get a total knee in right, you have to get the right angle and the right measurements and the right alignment. Normally we do that with what's called manual instruments. So we put a rod in the thigh bone, sometimes in the shin bone, and we measure off of that. Then we take those back out.
Oh yeah, I see it. That's changing thanks to this, an AR headset that Dr. Kassab wears during surgery. It's a navigational tool which maps bone alignment and allows for extremely precise measurements.
So I can dial it in to the patient's anatomy. So I get this kind of the blue line, which is the patient's axis, and I can turn the dials to get it to so that the knee lines up perfectly with that.
Okay.
And which again is next to impossible to do without some sort of technology. And this is supposed to represent the shin bone. This is the thigh bone.
Okay. Think about your knee like a hinge on a door. If anything's off, the door doesn't close. In a knee replacement, that misalignment can cause continuing pain.
It's like the tires on your car, right? If they're not aligned properly, they're going to wear out faster. So getting that perfect alignment hopefully will give you the longest life out of your knee. What's happening is the bone's rubbing on bone, and that's making noise.
I can't stand for 5 minutes.
Rita is 86 and can't believe how suddenly it's so painful to move.
It's very scary, but it's also exciting because I researched all of this myself, you know.
She's ready for surgery.
We got 120 yesterday.
With help from physical therapy, Sandy is amazed at how well she's doing just 24 days after her knee replacement. And when she's not busy at her barbershop, you will find her down on her farm with all of her grandkids, putting that new knee to good use.
I'm feeling great. I don't have any knee pain. I don't take any pain meds.
Now, Rita had her surgery just days ago. I'm told it all went very well. The name of the specific technology is called Pixee Knee NexSight. Dr. Kassab believes this will eventually be the norm when it comes to knee replacement. That's HealthWorks. I'm Dina Santa.